So if I can ask you a question, the way you say it is like everything will remain the same. If you are with an insurance company through your employer right now, you will still, if you like, you can still pay that insurance and go to the doctor just like you always have. The HMO and PPOs are not going to go away, but that this public auction will be like another type of insurance that you can get, and you can go that way.
That's perfectly correct.
Now, how are you going to be able to do that if you don't have any money?
Well, what do you mean if we don't have any money? The money will come from those that subscribe. Just like WellPoint and United subscribe on people that pay them premiums. That's where their money comes from to operate their organizations. That's where the money will come from to operate the public choice that will be offered as part of the insurance exchange, where everyone will have their policies up there for comparison, and people like me can pick and choose. Quite frankly, I have employer health care. I'm a retiree from the labor movement. I probably have one of the Cadillac plans and I might have to pay a tax. I don't mind that because I work hard for what I want and I'm going to keep what I have. But I see the need and I understand where that doesn't work for everyone that doesn't have what I am lucky enough to have. But they need something else that works for them and not just a dictatorial regime or dictatorial offering that says this is what you're going to have to pay and that's it. You know, you don't have any flexibility, you don't have any other alternatives. It's either this way or the highway. You know, either your band-aids are going to cost you a lot of money or you're not going to have any. That's not the way it should be done in America.
But what I understood, and I'm no expert at this, but I think I'm coming from a place that a lot of people come from that don't know that much about this, is what I understood about the universal health care, as they call it, would be for people that can't afford health care now, because there's a lot of people in that basket. I mean, there's people who can just barely not afford it, and there's people that can't afford it at all. So how is that going to work for people that can't afford it? I mean, they just don't have any money to go to health care.
Well, part of the proposals, in fact, in all the proposals, are a feature that will subsidize people in that status.
Okay.
People that cannot pay for it now will be able to get either a tax credit or a direct subsidy for them to be able to purchase insurance on the exchange.
Okay.
So that they will be able to find a policy that fits their economic needs. Mm-hmm. It might not get the Cadillac health care that I get,
right,
but it will cover them more now, so they're not going to the emergency room when they've got sniffles and a cold, costing the system a lot of money. You know, they'll be able to look at the exchange. They'll say, you know, government, I've only got $400 a month to pay, and this plan's going to cost $5. The government will say, okay, we're going to give you a tax credit for $100, so you'll be covered for that. Or there will be a direct subsidy available to you.
Okay.
You know, that will come. From the government, but then it will allow you to not spend the money necessarily on the public option, which may be the best and most financially reasonable choice for you to take, but it means that you could take that subsidy and use it along with your other funds to move up the ladder and purchase a better plan if that's what you were interested in doing.
Well, thank you very much, Guy. You've helped me understand it a lot better.
Okay, thank you very much for giving me the opportunity. I appreciate it.